Let's bring in Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with us at WAKR. And Joe, my goodness, tons of injuries in the NFL coming out of week 2. No preseason, limited training camp. How much of a role does that have?
Yeah, that's exactly the road I wanted to go down, Ray, is people are calling it Wipeout Sunday. I mean, not only, wow, the sheer number of athletes, of players that got injured, but the level of some of the best guys in the league. It was a huge day. Many people are trying to remember anything quite like Wipeout Sunday. Saquon Barkley, Nick Bosa, Christian McCaffrey, and the list is long and the list is significant, and a lot are done for the year. So people are exactly as you mentioned, trying to figure out why. Is it just a random happenstance? You know, we went through this with high school kids about 2 weeks ago. We had a real big spike or peak in our office of injuries, and we started to ask the same questions. Was it random? Was it that there really wasn't time for any live practice this year? There wasn't nearly as much hitting. There were not scrimmages or preseason games. A lot less contact that we're doing, maybe partly because of the concussion thing, but also particularly because of the COVID issue this year. Is it because during the quarantine period, people were working out differently, that this was all just working out and the athletes are just so bulked up and strength-wise and not ready for the rigors of running and hitting people? That's a theory that's out there. One of the things that's being discussed, and we saw it in several of the injuries on Sunday, is that many of these people had more minor injuries, a week or two before or in training camp, and then they went out and they had a much more significant injury, maybe a season-ending injury. So do more minor injuries predispose these people? And knowing sports medicine the way you do, about as good as any media person I know, one of the injuries that we'd be looking into very closely is going to be what? Is going to be concussion. Mm-hmm. And so we were on a conference call yesterday, and we've been working on this for a little while, just kind of getting started with a big group from Dallas at the James Andrews Sports Medicine Clinic, together with our clinic, and we are beginning to look at, in high school and junior high school athletes that are concussed, what's their risk of going back and getting an injury, a musculoskeletal injury somewhere else? A lot of people have looked at this in the professional level, a little bit in the college level. Nobody's really looked at it in the high school level, and to what extent. So that, in other words, as you well know, with concussion, we get people back, but we don't always know if they're getting back to 100%, if they have any residual of the injury. And the residual, when it comes to concussion, would be things like a loss of reaction time, a loss of speed, moving laterally in different ways. The body just doesn't respond the same way. And don't you think that might be a recipe for having other musculoskeletal injuries? And so certainly we've looked for a long time and kind of made that connection that concussions, when people get back and have some residual, they are really at risk for other musculoskeletal injuries. But in this study, we're really going to look at that more closely and try to quantify it, try to see if there's anything we can do to tell what types of injuries should not get back as quickly to play following concussion. And so we're pretty excited about, the way it is in sports medicine. If you're going to have a question like that, you've got to answer it, and the way you have to answer it is through research. So this is probably going to be a 2 or 3 year study, and we're just getting started, but we're pretty excited about our partnership with the Andrews Clinic in Dallas.
Dr. Joe Congini with us, Akron Children's Hospital. Joe, back to those injuries all across football over the weekend with a number of knees and ankles and that type of thing in the preseason type of football. And often we say, well, less games, maybe less injuries, more practice time. But, boy, practice and gaming, we saw the injuries in week 2, not so much week 1. We talk about the off-season training that is so important. But is there also the body saying, I need game conditions as well to build up my strength?
I do believe that that's a piece of it. And like so many things in the world, Ray, I think this is multifactorial. I don't think there's going to be one question that answers it all. But when I see a bunch of athletes, and by the way, in our study and in what we're looking at not just football. So we're using these Sunday football players to extrapolate down to our our high school soccer players and our junior high lacrosse players and other things like that. But I when I looked at all these people and they were practicing with Zoom videos and they really weren't getting a chance to practice together and they weren't able to do anything live and there really wasn't any hitting. And I believe there is some acclimatization period, just like there is for heat, to the hitting and rigors of contact sports. And so I am definitely with you. I think that first theory of no hitting, and reducing hitting so much and reducing really any scrimmaging or live game time was definitely one of the big factors in multifactorial reasons why we saw so many injuries this weekend.
Joe, great stuff this morning, my friend. Thank you for making time to visit. And you know it. We'll talk to you again next Wednesday.
All right, Ray. Looking forward to seeing you next week. Thanks.
You got it, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center, joins us live Wednesdays on Sports Medicine here on WAK.